My channel, and today we are going to continue from the question number 51, and these are the anatomy recalls as well as the practice SPAs. And let's start with our question number 51. The question number 51 is the bladder contraction. Bladder contraction during voiding or micturition is mediated by the innervation of which of the following pathways? And here the options are different from the question. So let's see what we are going to have. Okay, no, sorry. This question is wrong. Question number 52. Again, the bladder contraction during voiding micturition is mediated by the innervation of which of the following pathways? The correct answer is parasympathetic fibers from S2, S3, and S4 nerve root. Deuteracer contraction is why the parasympathetic. The deuteracer contraction, which lead to the micturition, they are why the parasympathetic innervations, which are the innervations from the pelvic splanchnic nerve. It is the pelvic splanchnic nerve, and the pelvic splanchnic nerve has the root of the S2, S3, and S4. So the option number B, which is the parasympathetic fibers from the S2, S3, and S4 nerve roots, is the correct answer. And this nerve, the pelvic splanchnic nerve, also lead when at the same time when it is contracting the bladder, it is contracting the bladder, it is also going to help in the relaxations of the internal urethral sphincter so that the urine come out from the urethra. Okay, and the external urethral sphincter is under the sympathetic control or the somatic control, which is that it is the voluntary control, so that when the someone has urge to pass the urine, the pelvic splanchnic nerves, they are going to contract the bladder, and on the same time they are going to relax the internal urethral sphincter, and under the man's or the women's control, they are going to relax their external urethral sphincter, and it will help to avoid the urine. Now moving towards the next question, what is the boundary between the true and false pelvis? So here is the pelvis, and the boundary, which is very important, which helps to differentiate between the or there is a boundary between the true and the false pelvis. It is the pelvic brim. It is the pelvic brim. Yes, it is a pelvic brim. And the false pelvis, it is the part. The false pelvis is the, if we consider this as the pelvis brim, the false pelvis, it lies above the pelvic brim, and the true pelvis, it lies below the pelvic brim. So the pelvic brim, it is the boundary between the false and the true pelvis. Okay, and it is the vagina. It is the vagina which divides the pelvis into the anterior. If this is the vagina, it is going to divide the pelvis into the anterior and posterior compartments. Okay, and here this is the diagram, and if you see, this is the pelvic brim. If you see, this is the pelvic brim, or the inlet, pelvic inlet. Then the below this pelvic brim is the true pelvis, and above is the false pelvis, and here there is a you can see that this is a pelvic outlet, and different angles, but we are going to discuss these angles in our upcoming MCQs. So here just memorize that it is the pelvic brim. Above the pelvic brim, it is the false pelvis, and below the pelvic brim, it is the true pelvis, and it is the vagina which divides the pelvis into the anterior compartment and the posterior compartment. Okay, now let us move towards the further MCQs, and it is a question number 54. And which artery exists the pelvis by the greater sciatic foramen and re-enters via the lesser sciatic foramen? We have also discussed this in the previous MCQs, that it is the internal pudendal artery. It is the internal pudendal artery which travels via the pudendal nerve, and they exist the pelvis by the greater sciatic foramen and re-enters the pelvis by the lesser sciatic foramen. And it is important as this internal pudendal artery is important because it supplies to the genitalias, and there are the three arteries which exist the pelvis by the greater sciatic foramen. Number one is the internal pudendal artery, number two is the superior gluteal artery, and number three is the inferior gluteal artery. These are the three arteries which exit the pelvis along with the internal pudendal artery and the pudendal nerve via the greater sciatic foramen. It is then when they exit the pelvis, there is only one artery which re-enters the pelvis via the lesser sciatic foramen, and it is the only the internal pudendal artery which also re-enters into the pelvis via the lesser sciatic foramen. Where this is the internal pudendal artery, this is the internal pudendal artery. Okay, it exists from the greater sciatic foramen and re-enter the pelvis by the lesser sciatic foramen. Question number 55. The ureter is lined by what type of the epithelium? It is a very important and very beautiful question, and there is a transitional epithelium which is present in the bladder and the ureter. It is a transitional epithelium which line the ureter as well as the bladder. Okay, and here let us just see the few important epitheliums, and number one is the simple squamous epithelium, and it is usually present in the air sacs of the lungs and the linings of the heart, blood vessels, and the lymph vessels. The functions is they allow the material to passes through the through by the diffusions and filtrations and secretes the lubricating substances. And number two is the simple cuboidal. It is present mostly in the ducts, secretions portions of the small glands, and in the kidneys and the tubules, and their function is mostly the secretions and absorptions. And number three is the simple columnar epithelium. The first is the ciliated tissues. They are in the bronchi, the uterine tubes, and the uterus, and the smooth which are non-ciliated, they are in the digestive tract and the bladder, and they helps in the absorptions, and they secretes and it also secretes mucus and enzymes. Number four is the pseudostratified columnar epithelium, and they are the ciliated tissues. They lines the trachea and much of the upper respiratory tract, and they secrete the mucus, and the ciliated tissues they moves the mucus. And number five is the stratified squamous epithelium. They lines the esophagus, the mouth, and the vagina, and they protects against the abrasions. And number six is the stratified cuboidal epithelium. They are present in the sweat glands, in the salivary glands, and the mammary glands, and they protect the tissue. Number seven is the stratified columnar epithelium. They are present in the male urethra and the ducts of the some glands, and they secretes and protects. And number nine is the transitional epithelium. It is present in the bladder, urethra, and the ureters, and they allows the urinary organs to expand and stretch. Now, question number 56. You are asked to assess a patient, the perineal tear, the following the labor by the vaginal delivery. You note a lacellation that extends approximately a quarter of the thickness through the external anal sphincter. How would you classify that? We have discussed in previous MCQs that if the external anal sphincter is intact, if it is intact, then the tear is either first degree or second degree. If the muscles are involved, then it is the second degree. If the muscles are not involved, then it is the first degree tear. Here, here in our MCQs, there is the involvement of the external anal sphincter, and how it is involved, it is involved that it is extended a quarter of the thickness. If this is external anal sphincter, then this is the half, and the only quarter of the external anal sphincter is involved. Then how you are going to classify it? It is the third, as the external anal sphincter is involved, then it is the third degree tear. But the quarter of it is involved, then it is the A. It is the 3A. So the answer will be the 3A. And the 3A is that if the laceration is less than 50%, like if it is less than 50%, then it will be A. If it is more than 50%, then it will be B. And if it is also involving the internal anal sphincter, then it will be 3C. Okay. Now let's move towards the next question. The inferior one third of the rectum is principally supplied by which artery? It is the middle rectal artery which supplies the rectum, and the inferior one third of the rectum is supplied by the middle rectal artery. And the inferior rectal artery, it supplies the anus. Remember, inferior rectal artery, it supplies the anus, and the middle rectal artery, it is the principal supply of the lower one third of the rectum. It is the middle rectal artery which is going to supply the lower one third of the rectum. And the rectal arteries, they also going to make the anastomosis from the both sides. It is very important. Now, next question. The axial filament of the sperm tail has what type of the arrangement of the filaments? It is the answer is 9 plus 2. And here we are going to in this see this diagram that the axial filament of the sperm tail, here this is the sperm tail, this is the sperm tail, this whole is the sperm tail. Okay, this is the sperm tail, and it has, this portion is the axial filament, this portion is the axial filament. And they I have asked that this is the head of the sperm, this is the head of the sperm, and this is the mid or the connecting point or the connecting place of the sperm, and this is the tail of the sperm. Okay, and here they have asked that what is the arrangement of the axial filament of the tail, and that is 9 plus 2 arrangement. 9 plus 2 means, what is 9 plus 2? 9 plus 2 is that 2 are the central and 9 are the peripheral. It has a pair of the longitudinal fibers that are called the beta fibers, and they are surrounded by a ring of 9 pairs of the longitudinal fibers called the alpha fibers. They are called the alpha fibers. So there is a pair, like they are the 2 pair, which is the central. These are the beta fibers. They are present in the center. They are present in the center of the ring, and the 9 and the other 9 pairs. It is the 9 pair which are surrounding the beta fibers, and these are called the alpha fibers. So there's a 1 pair, there's a 2 pairs, there's a 3 pair, 4, 5, 6, 7, 8, and 9 pairs. So this is a rough arrangement of the filaments of the axial or of the tail, or the axial filaments of the sperm tail. The lymph from the scrotum, they drains into which node? These are the superficial inguinal nodes. The superficial inguinal nodes, they form the scrotum, and they drain the lymph from the scrotum. And the scrotum, it drains to the superficial inguinal nodes, unlike the testes that drains to the lumbar and the para-aortic nodes. Next question. The median umbilical artery, the median umbilical ligaments, is a remnant of what structure? It is the superficial. Here they have asked that the median umbilical ligament in the adult life is a remnant of which fetal structure? It is the remnant from the umbilical arteries. It is a remnant from the umbilical arteries. Sorry, it is not from the umbilical arteries, it is from the urachus. This is median. Here they use the trick. You have to read the MCQs twice or thrice when you answer it. Like if it is the median, they have asked about the median umbilical ligament. These are the remnants of the urachus, and the other is the medial umbilical ligament. They are the remnant of the umbilical arteries. Again, we're here. I'm going to again tell you this thing, that you have to read the question twice or thrice before answering. as they have asked in the previous MCQs, they have asked the medial umbilical ligament, that is the uterine arteries, and sorry, not uterine, it is umbilical artery, sorry, again, it is the umbilical artery. And the median, this is so confusing, like I also get confused a lot of the times, like if they are asking about the umbilical arteries or umbilical veins or the uterine arteries, this is a very common confusion questions, so you have to be very careful before you answer them. The median umbilical ligaments, they are the remnants of the urachus, and the medial umbilical ligaments, they are the remnants of the fetal umbilical arteries. Now the next question. Now let's move towards the next question. The hypothalamus is present in which part of the brain? It is present in the Dan's phalon, and the Dan's phalon is hypothalamus is located in the Dan's phalon, and it is made of the several nuclei with the distinct functions. And here is the pictorial view, and here you see that this is the location of the hypothalamus. This is the pituitary gland, and this is the hypothalamus, and it has got the different nuclei. The arcuate line, they forms the part of the bottom of the pelvic brim. Where is it located? Where is the arcuate line located? It is present in the ilium. This is the ilium bone, and this is the arcuate line, and it is present in the ilium. So the correct answer is the ilium. And arcuate, it means the bow shape, the bow shape. And there are the different arcuate lines in the anatomical term regarding the pelvic brim. This is composed of the arcuate line of the ilium, the pectineal line, and the prominences of the sacrum, and the pubis symphysis. So the arcuate line, it includes the ilium, this is the ilium, the arcuate line, and the pectineal line, and the prominences of the sacrum and the pubis symphysis. These are the prominences of the sacrum. This is the pectineal line, or the ilium. This is the symphysis pubis. The basic functional unit of kidney is what? It is the nephron. It is nephron. Nephron is the structural unit of the kidney. The roof of the femoral triangle is formed by which structure? It is the fascia lata. We have discussed it previously in our previous MCQs, that if this is a visual view of the femoral triangle, then what is the roof? The superior, there will be inguinal ligament. The roof, it will be formed by the fascia lata. On the medial side, there will be the medial border of the adductor longus. On the lateral side, there is the medial border of the sartorius, and the floor is made up of the PIA, which is the pectineus, the iliopsoas muscles, and the adductor longus. The transversalis fascia, they also forms the transversalis fascia. It forms the part of the inguinal canal. Now the next question: what is the inferior border of deep perineal pouch? The inferior border of the deep perineal pouch, it is formed by the perineal membrane. The perineal membrane, it is also known as the inferior fascia of the urogenital diaphragm. It separates the deep and the superficial perineal pouches, and it is the inferior border of the deep perineal and the superior border of the super. The deep pouch is the space, therefore, between the superior and inferior layers of the urogenital diaphragm, and the superior fascia of the urogenital diaphragm in the superior border. I'll find the picture and I'll let you know, and I'll explain this again for you in the upcoming questions. Okay, no need to be worried about it. Okay, now the next question is the femoral triangle. It contains all of the following except which? Now this composition of the femoral triangle, and this is the question is except, like there will be one thing which is not present in the femoral triangle, but the rest of the things will be passes through the femoral triangle. So first of all, we should know what are the composition of the femoral triangle. If this is a visual view of the femoral triangle, then what is going to pass through it? Number one, the femoral nerves, they are going to pass through it. and the terminal branches. Again, the second is the femoral sheath. The third is the femoral artery and its branches. The fourth is when there is artery, there will be the vein, the femoral vein and its proximal tributaries. And then the deep inguinal lymph node. We know that the arteries, veins, and lymph or the nerves, they are going to travel together. Okay, when there's a nerve somewhere or between, there will also be the lymph or lymphatic vessels also going to travel with them. So just remember that the femoral artery and its branches, the femoral vein and its tributaries, and the femoral nerve and its branches. So the three things are here, and also the deep inguinal lymph nodes and lymphatic vessels are also going to travel through them. And the fourth is the femoral sheath. Femoral sheath. Here I made a small mnemonic for to memorize the contents of the femoral triangle, and it's a one cells. It is the composition of a femoral triangle. Okay, so let's move towards options. It is the deep inguinal lymph nodes. Yes, we know that they are present in the femoral triangle. Then the saphenofemoral junction. Yes, that they are also present in the femoral triangle, as we have discussed that the femoral vein and its tributaries for the saphenofemoral junctions they are going through the triangle. Then the femoral sheath, yes, femoral nerve, and the last, which is the genital branch of the genitofemoral nerve. No, it is not. It does not passes through the uh, femoral triangle. Okay. So which of the following arteries is a branch of the internal iliac artery? The branch of the internal iliac artery. So which of the arteries is a branch of the internal iliac artery? The uterine and the vaginal arteries, they are the branch of the internal iliac arteries. The ovarian arteries, they come from the aorta. Okay, so the answer here is the option is not here, but there is the option of the uterine. So you can say that in the given options, the uterine is one of the arteries which is a branch of the internal iliac artery, and the ovarian is not the correct answer, because we have discussed that the ovarian, they arises directly from the aorta. Okay, so here's are the ovarian arteries. They are going to come from the aorta. The uterine arteries and the vaginal arteries, they are going to come from the internal iliac artery. Next question. A 74-year-old patient is seen in the clinic. She has been found to have the ovarian epithelial cancer. This is the ovarian epithelial cancer with the malignant cell on the pleural effusion aspirates. There the pleural effusion aspirates is positive for the malignant tissue. She is diagnosed for the stage 4 ovarian cancer. What is the 5-year survival for the stage 4 cancer? This is the stage 4 cancer. So what is the survival? For a stage 4 is, again, it has a very poor prognosis, and it has the survival of the 17% with the 5-year survival. So if we see that these are the relative survivals. Stage 1 has 90% 5-year survival, stage 1A has 94%, 1B has 92%, and 1C has 85%. Stage 2 has 70%, stage 2A is 78%, stage 2B is 73%, and stage 3 is 39%. 3A has 59%, and 3B has 52%. 3C has 39%, and stage 4 has the 17% survival rate in the coming 5 years. Now the next question, regarding the structures of the deuterostomy muscles, which of the following is true? Now let's see what are the deuterostomy muscles. The bladder wall, it has 4 layers. The bladder, it has 4 layers. Let me see if there is a diagram. I'll add it for you on the coming questions. Okay, it has 4 layers, and it has tuser layer, which is in the organized in the 3 sublayers. It consists of 2 predominantly longitudinal layers, and which are sandwiched between middle predominantly circular smooth muscle layers. Like they are the 2 longitudinals and the circular layers, and then the longitudinal layer in the bladder or the uterine muscles. So let's just come with the answer that We know that the detrusor muscle, it is divided into three layers, and it consists of the inner and outer layer being the longitudinal, as we have discussed here, and the middle is the circular layer. So let's see the options. The detrusor is a single layer. No, we know that it is three layer structure. Then next is the detrusor is a single layer. No, it has three layers. And the detrusor is again a single layer. Again, this answer is not correct. The detrusor is divided into two layers containing of inner longitudinal smooth muscles layers and outer. No, it has three layers. The detrusor is divided into three layers. So the correct answer will be the detrusor is divided into three layers, and it is consists of inner and outer layers of the longitudinal smooth muscles with a middle circular. Okay, apologies for having the voices of my kids in the background. I decided to do it in the daytime, so like my kids are playing around and like they are making, they have their stuff to do. So again, sorry for the interruption. I have. Okay, let's do it again. That we know that the detrusor muscles, it has three layers. There are the two layers longitudinals. These are the inner and outer layer, and in between there are the circular fibers which are present in the detrusor muscles. So we know that detrusor consists of the three layers of the muscles. The inner and outer is longitudinal, and the inner is the circular. So the option E is correct. Now let's move towards the next question regarding the structures of the, again this is the same question, repeat of the same question, and the answer is that their detrusor is divided into three layers. Okay, now let's move towards the next question. The lower part of the rectum is supplied by the middle rectal artery. Yes, it is true. What is the middle rectal artery branch of? Like they are asking from where the middle rectal artery it arises. The middle rectal artery, it is the branch of the internal iliac artery. It is a branch of the internal iliac artery. The question is that internal iliac artery is true. Here we come there the major suppliers of the supply of the colon, and the ascending colon is supplied by the superior mesenteric artery. The transverse colon proximal two-third is again supplied by the superior mesenteric artery. The transverse colon is supplied by the inferior mesenteric artery, and descending colon is supplied by the inferior mesenteric artery. Sigmoid is supplied by the inferior mesenteric artery, and rectum is the upper two-third of the rectum is supplied by the inferior mesenteric artery. The lower one-third is supplied by the internal artery, which further give tributary to the middle rectal artery, and the anal canal is supplied by the internal potential or the internal potential artery, which arises from the inferior rectal artery. Okay, here it is a diagrammatic view of the colon and their blood supplies. Okay, now let's move towards the next question. The anterior scrotal artery is a branch of which artery? Like from where the anterior scrotal artery it arises? The anterior scrotal artery it arises from the external pudendal artery. It arises from the external pudendal artery. And question number 72. How many lobules are there in the testes? There are 250 to 400 lobules in each testes. The lobule it is a structural unit of the testes, and each lobule it contains one of the interval between the fibrous septa, and which extends between the mediastinal testes and the tunica albuginea, and each lobule contains 1 to 3 seminiferous tubules. Now the testes they receive innervation from which spinal segment? Testes they receive innervation from T10. We all know that originally the testes as well the ovaries in the fetal life, they are the part of the abdomen, and there the they have got their innervations from the T10, and then with the passage of the time they travels down to the pelvis, and the testes they eventually come out from the body, but they are innervated from the segment, their fetal segment, that is the T10, and they provide the sympathetic nerve fibers that innervate the testes. Which of the following statement regarding the vaginal artery is true? So let us discuss regarding the vaginal artery. The vaginal artery and the uterine artery, they are the branches of the internal iliac artery. Internal iliac artery. We have discussed here previously in our diagram that these are the ovarian arteries. They come from the aorta, and the uterine artery and the vaginal arteries, they come from the internal iliac arteries. Okay. Now, so they are the branch of the internal iliac artery, and it can also arise from the uterine artery. And so important when you have to read the options as well, that they arises from the internal iliac artery. Option is correct here because internal iliac artery is present. But if the option of the internal iliac artery is not present, then you have to point out the uterine arteries, because sometimes they do arise from the uterine artery. Okay, now the next question, and regarding the lymph drainage of the ovary, the lymph drainage of the ovary, where does the majority of the lymph drains into? That are the para-aortic nodes. The ovaries lymph, they drains primarily to the lateral para-aortic lymph nodes. Next question. What are the proximal and distal centriole located in a spermatozoa? Spermatozoa. The proximal and distal centrioles, they are located in the spermatozoa. They are present in the neck of the sperm. The centrioles, they are located in the neck and they lie posterior depressions of the neck. So there in the previous diagram we have discussed that this is the head, this is the neck, and this is the tail of the sperm. So it is the neck which where there are the centrioles. They are located in the in the neck of the sperm, and they are necessary to initiate the zygotic division. You are called, next question, you are called to see a woman after a prolonged labor with a failed instrumental delivery converted to C-section. She's unable to dorsiflex. So the you have to understand what they are asking. She's unable to dorsiflex her right foot and complains of pins and needles to the foot and the lower leg. What is the diagnosis? It is the so we have risk factors here. That is the prolonged labor, number one, then the instrumental delivery, two, and later it is converted to C-section. And again, when the patient is unable to flex the foot and complains of pins and needles in the foot, then it is the common perennial nerve that is involved. It is a common perennial nerve that is involved here, as that she is unable to dorsiflex her right foot. So the right common peroneal nerve root compression is the correct answer, and this is the typical presentation of the foot drop, and it is caused by the compression of the common peroneal nerve and superficial peroneal nerve palsy. They may cause a similar pattern of the sensory loss, but the innervation of the anterior compartment leg muscles is by the deep peroneal nerve, so the foot drop would not occur in the case of the superficial peroneal nerve palsy. The nerve palsy, it is encountered in many surgical field, as the nerve is very superficial as it winds around the fibular head and prone to the compression palsy. And when the patient, they are usually make the position of the lithotomy position, because it is superficial nerve, and it is just passes around the fibular head, which is very superficial. When the patient is in the lithotomy position, this nerve, they usually get compressed, and comes with the presentations of the foot drop either, or in the case of the superficial peroneal nerve palsy, there will be no footfall, but the patient would be complaining of the sensory loss in the anterior compartment leg muscles. And there is a L5 nerve root compression. It can produce the symptoms, the similar symptoms, like, uh, but uh, but this is very uncommon, and hence our surgery will not unlikely that they will give you the same MCQs or the SPAs. Now, the next question, the blood testis barrier is formed by the junction between which type of the cells? Yes, the answer is the Sertoli cells. The blood testis barrier, it is sometimes referred to as the Sertoli cell barrier, because the Sertoli cells, they are the cells of the seminiferous tubules, and they have the tight junction as seen in the here we can see in the diagram that they have the very tight junctions they form they form, and they are present inside the seminiferous tubules, and they are separated from the blood and the lymph. The certoid cell barrier is often described as the dividing the seminiferous tubules into an adluminal, such that the central or luminal part of the tube and the basal layers. The basal layers, they contains the spermatogonia and the blood and the lymph. The adluminal layer, they contains the sperm cells in the various stages of the development. The presence of the Sertoli cell barrier, they allows for the control of the luminal environment. Okay. Now the next question: what testicular cell type secretes the testosterone? Testosterone, we have discussed it many times. That testosterone, it is secreted by the Leydig cells, and the inhibin is secreted by the Sertoli cells. And L4 Leydig, L4, they have the LH receptors, and opposite as Sertoli, and which is secreting the inhibin, they have the FSH receptors. Okay, now the next question: the external anal sphincter is innervated by which nerve? They are the external anal sphincter, it is innervated by the inferior rectal nerve. These are the inferior rectal nerves. The anal sphincter, it is divided. If there is an anal sphincter, we have discussed, then they are divided into the internal anal sphincter and external anal sphincter. In the internal anal sphincter, it is involuntary, while the external anal sphincter, it is voluntary. Internal iliac sphincter, it has the sympathetic contraction and the sympathetic contraction and the parasympathetic relaxation, and they are innervated by the pelvic splanchnic nerve from the root of the S4. On the other hand, the external anal sphincter, it is innervated by the inferior rectal branch of the parental nerve and the perineal branch of the S4. And the most common thing that they has the voluntary control over it. Voluntary control in the internal anal sphincter, involuntary, it is involuntary, and sympathetic is by the contraction, and parasympathetic is by the relaxation. So there is another diagram of the anus. This is the internal anal sphincter, and these are the external anal sphincters. Next question: a baby with the shoulder dystocia, they suffers the brachial plexus injury. A baby with the shoulder dystocia, they suffers a brachial plexus injury. To diagnose the Erb Duchenne palsy, which nerve roots are typically affected? The nerve roots which are affected, they are the C5 and C6. The answer C is the correct. And Erb's or the Erb Duchenne palsy, it is the type of the brachial plexus injury. The brachial plexus, it comprises of the C5 to T1 nerve roots. In the Erb palsy, C5 and C6, they are the roots primarily affected. Shoulder dystocia is the most common cause of the Erb's palsy. Next question: in the male urethra, which is the narrowest part? This is the most asked question. And remember that it is the membranous urethra. Membranous urethra, it is the narrowest part of the male urethra. There are the three parts of the male urethra, which is the prostatic, membranous, and spongy, which is also known as the penile or the cavernous part. And this is the most common asked question is the narrowest, regarding the narrowest part of the urethra, and the answer is the membranous urethra. Now the next question: the juxtaglomerular apparatus, it lies within which part of the kidney? It is the renal cortex, where there are the multiple juxtaglomerular apparatus, they are the present. The substrates, the substructures of the nephrons, they are mainly located in the cortex. The juxtaglomerular apparatus, it sits near to the glomerulus in the cortex, and they play an important role in the blood pressure hemostasis, as the juxtaglomerular cells, they produce the renin. And the descending and ascending limbs of the loop of the Henle and the collecting ducts, they have secreted, they have the sections both present in the cortex as well as the medulla. Now the next question: what type of the epithelium they lines the urinary bladder? We know that it is the transitional epithelium, which lies not only the urinary bladder but also the ureter and also the urethra. And here this answer is wrong. The bladder, it is lined by the transitional epithelium, and it is found in the ureters and the proximal urethra. And here this again they have discussed the summary, and we have discussed it previously, so we are not going to do it again. Now let's move towards the next question. The superficial inguinal ring. It is an aperture in which a structure. It is present or the like the superficial ring. It is the exit of the inguinal canal, and it is a triangular aperture in the aponeurosis of the external oblique muscles, and the conjoint tendon they reinforce the ring posteriorly. Now the male scrotum, it is has typically how many degrees cooler than the body temperature? It is the 2 degree, which is very important, and it is 2 to 2.5 degree cooler, and which helps the enzymes which are involved in the spermatogenesis. Now regarding the uterine artery, which of the following statement is false? So let's discuss the uterine artery first. And the uterine artery, it typically arises from the anterior branch of the internal iliac artery. We know that it comes along with the vaginal arteries from the internal iliac artery, and it crosses the ureter anteriorly. We have know that it is the water under the bridge. The water under the bridge is that uh, 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 I'll discuss it, and I'll explain it later when it comes MCQs. But just remember that there is a MCQs which is regarding the water under the bridge.